Hi, everybody. Welcome to another episode of Sessions with Paola. Today is just a very special day because I have the pleasure of introducing one of my favorite people in the world, Dr. Claudia Rodriguez. Dr. Claudia Rodriguez is an addiction psychiatrist originally from Colombia, raised in South Florida, and medically trained in Boston. She has expertise in the treatment of addictions and co-occurring psychiatric disease, having held leadership and clinical roles in one of Boston's most renowned medical systems prior to returning to her home in South Florida. She approaches her patients with a spirit of collaboration, an acknowledgement of the resilience that lives within each of us, and a goal of empower individuals with knowledge, information, and tools to heal and recover. She's now the founder of Reclaim Sunshine Psychiatry, which came after years of working with individuals who made the courageous decision to tackle change and succeed. In essence, to reclaim sunshine. We're so fortunate to have her here practicing in South Florida. So welcome, Dr. Rodriguez.
Thank you. It's a pleasure to be here. And I'm so excited to talk about today's topics, which are crucial for us all to understand. Thank you for having me.
Of course. So I want to start with, Dr. Rodriguez, tell me a little bit, what inspired you to become an addictionologist?
So the inspiration came to me, honestly, as part of my psychiatry training during my psychiatry residency, which is 4 years that you spend really learning the field of psychiatry. I had the honor and the very exciting opportunity to work alongside Dr. John Renner, who's been a pioneer in addiction treatment for decades. And I sat back as a student and I was able to just witness the power of a therapeutic relationship, how amazing it was to witness change happen before you. And honestly, when you think of addiction treatment, how inspiring your patients are when they show you how they can change, when they show you how they empower themselves to make change, and when they just do these things that they never thought possible. I was not only inspired by the patients that I was able to witness, but I was also just really touched by the relationship that this physician had with their patients and helping them accomplish that. One that kind of respected their autonomy, that respected where they were at, and also helped guide them in making, these really valuable, long-standing changes in their lives. And there's not a lot of places in medicine where I felt like I was that inspired. And so honestly, I just wanted to be a part of that.
Wow, amazing. Not only having mentors that inspire us, but also I think when you talk about the therapeutic relationship, me in the psychology field, I feel the same way. The connection with your therapist, with your psychiatrist is just so, so important. Yeah. Let's move on to talk a little bit about, I wanted to have you here because I'm really interested in talking about myths around addiction. Unfortunately, the news, media, and even people have a hard time understanding the complexity of addiction. And so sometimes we may say things like, well, addicts, and I'm putting it in quotation marks because the more accurate description is people with addiction, people that suffer from addiction. And it was interesting because I was consulting on a case with Dr. Rodriguez and, wasn't thinking, said the word addicts, and she softly kind of said like, hey, this is a better accurate description. This is, I think, what, makes more sense. And Dr. Rodriguez, let's start there because I'm wondering, why is that correction important?
Yeah, so there's so much work being done around changing the stigma related to addiction. And this goes to the myths, and we'll talk about that in a minute. But when you say or call someone an addict, what you're using is you're defining their disease as the person that they are. And people that are suffering with addiction are so much more than their disease. Their fathers, their mothers, their sisters, their brothers. They are friends, they are cousins, they are individuals who are unfortunately lost to a disease. We would say the same thing like when we talk about diabetes or any other disease. Really, you want to put the person first. It's a person with an addiction. Keeping in mind that this is a human being that we're talking about. It's not just the disease that's in front of us. That might be what we see, but it's really important to highlight that there's a human behind that. And there's other terms that we use in our communities, such as clean. When we talk about someone being clean instead of being in recovery or being healthier, we're almost saying that they were dirty when they were using. Those terms can have like really negative connotation when somebody that's living with the disease hears them as describing them as a person. So that's why we're trying to change the language. Words matter, and they can have a great impact when we're talking about people.
I love that. I love that because it almost reminds me the clean and dirty, almost my work with sexuality, right? But we won't get into that today. I think, Mitz, and you mentioned something that I think it's so important because these humans are mothers, sisters, brothers. You know, sometimes we may say, ay, pero ¿cómo le va a hacer eso a la mamá? A esa señora que es tan buena. How are you going to do that to that mother? That mother is so nice. Implying that there is a choice, that I can kind of turn this on and off. And also, you know, people with addiction are selfish. So, Dr. Rodriguez, you're so good at educating. This is something that I just really admire and love about you. So tell us a little bit, help us, give us a little window into what happens in the brain. How do people get there? What, you know, and I think something that I want to mention because, you know, back in the day we're like, oh, well, crackheads. We think that these people are in the corner, you know, smoking crack or doing heroin. And I think the opiate crisis really changed that for a lot of us because it was anyone. It could have been me. It could have been you. It could have been anyone. So let's start with why is it important for people to understand, like, really the complexity. Let's talk about brain. Let's talk about trauma. Let's talk about all that good stuff.
Oh, my goodness. So, you know, the difficulty and the beauty of addiction is that it is a very complex disease. And what that means for me as a provider is that I need to approach each patient as an individual because that individual can have a very different story compared to another individual. But there are genetics, so there are things that are going to increase our risk of potentially developing an addiction after you're exposed to a substance. So for example, genetic predispositions. If you have a family history of substance use disorders in your family, if you have a mental health disorder in your family, if you yourself are struggling with a mental health disorder, those are all risk factors for developing an addiction. Secondly, we think about how our environment can impact genetics and how our environment can impact our lives. There's lots of studies that look at average childhood experiences. What those are traumas that are experienced in childhood, either witnessing or being a part of verbal, physical, sexual abuse, having parents that use substances in the home. Having one of those greatly increases your risk of starting using substances at an earlier age, which greatly increases your risk of eventually developing a substance use disorder. So how the environment impacts kind of like our brain and our predispositions is another important factor. How we access mental health care. You mentioned, you know, crack and you know, if we have time to talk about race, that would be great. But we think of kind of like the racial drive and the disparities that have happened in the criminalization of drugs. It's amazing to think of the impact that that has had in how we approach treatment and how we approach the disease. And then finally, and importantly, we need to recognize this as a brain disease. When you think about the changes that happen over time to our reward system, which is a system in our brain that includes structures that are primitive. Some of them are structures that basically have allowed our species to survive. So the goal of our brain is to say, ooh, that food was delicious. I found this meal. How can I make that reward happen again?
Yes.
Right? How can I find companionship again? That's the whole goal of our reward system. But what happens with substances of use, of like cocaine, opioids, alcohol, etc., cannabis, you know, what have you, is that over time there are changes in that reward system that leads to a couple of things. One, it actually leads to changes that make you feel less pleasure over regular rewards. So if I'm using every day, this conversation may not feel as pleasurable as it does right now. It might feel kind of like, and I'm not as excited. A beautiful sunset might not entice me as much. A delicious meal might not feel good. Secondly, I'm conditioned to respond to triggers in my environment that lead to that thing. So this is when we talk about people, places, and things. Thirdly, I react to stress differently because of neurochemical changes. So I have a harder time coping with anxiety. I have a harder time coping with stress. And lastly, but also importantly, this part of your brain that we call the prefrontal cortex, it's kind of the part of your brain that like helps us make decisions. It's kind of like the part of our brain that says, you probably shouldn't do that, or like makes us think twice, or waits for a reward, like, oh, I'm going to do this now versus wait for a later reward. That part of your brain is also dysfunctional and imbalanced. So all of these aspects of your brain are impacted by drugs. And so if you think about it, you're really left with this very vulnerable brain. And as I mentioned, trauma, other aspects of life, I mean, it's hard. So being able to just stop and choose to stop, it's not a choice. What identifies addiction as a disease in the DSM-5 is loss of control. Loss of control indicates you don't have a choice. You really need that extra help to do so.
Oh, beautifully said. Beautifully said. And I think something that we talked about was, right, like thinking a little bit about Latina culture, communities of color, because now you're beautifully kind of transitioning into the other point that I wanted to make. How do psychotropic medications help? Unfortunately, I hear this all the time, especially with antidepressants. Fulanita me dijo, this person told me that she took antidepressants and it changed who she was, and she was somewhat like a zombie. And when that happens, guys, either the dosage is not right, and sometimes it can get a little frustrating because you need, it's a little bit of trial and error until you get the medication that really works. But it is so important, at least in our culture, we have the chisme. It's like, somebody told somebody and this means, and we take that as fact and that it's just not true. And when you talk, Dr. Rodriguez, because I've had clients, I worked with clients a long time ago, long history of OCD, long history of depression, and long history of alcoholism and opiate use. So these, when are we medicating another type of mental health disorder with substances and trauma? We are going to have a whole session on trauma and, criminalization and, people with addiction. That is going to come soon. But tell me, what do people need to better understand, especially Latino cultures, communities of colors, and everybody else that's listening, about how psychotropic medications can be beneficial for the treatment of someone with addiction?
Yeah, so I think, when you think of psychotropic meds, you already brought up some of the myths, right? I think that there's like the myth of the medication is not going to work, it's going to change who I am. And I can tell you that every provider, psychiatrist, primary care doctor, advanced practitioner, what have you, the goal of our medications is to give you a foundation or a stage so that you can be the best version of yourself yet, so that you can implement prayer, meditation, therapy, exercise, whatever it is that you're trying to do. It's meant to help you, to help tackle those neurobiological changes. And when it comes to opioid use disorder, we used to call it medication-assisted treatment, but the term has changed to medications for opioid use disorder, highlighting that it has to be a part of treatment rather than an assistance to. It's not secondary. It's really important. And medications for alcohol use disorder exist as well as for nicotine use disorder. Other drugs, they're still in the works, and there's not like the great medications that we have for opioid use and alcohol and nicotine. But the goal is really to help these brain imbalances, these neurochemical changes that happen over time. And then the other side is like a medication is going to make it all better. That's also a really tough thing to kind of like approach treatment with, because if you're open to using a medication, you want to remember there's all this other part of your life that you have lived with while you have suffered with an addiction. You have to heal. You have to forgive yourself for things that have happened while you've been using. You have to recognize that wasn't me. That was me that was lost at that time. And rekindle relationships and start taking care of your body and your mind in whatever way feels right to you. So I think those two myths can be harmful. And for our communities, I mean, there's always the one story, right? The one movie, the one this, the one that.
And it spreads like wildfire.
It spreads like wildfire. And keep in mind that, unfortunately, the stigma still exists. I could be sitting next to a person on a bus or a train or in Publix, and that person might be in full recovery, living a great life and be on buprenorphine treatment, and I have no clue, because the anonymity of addiction has caused the hiding of recovery. So we need to proudly say, hey, I'm in recovery, look at me, this can happen. And I think that's also something really important that's missing in our communities. There's a new movement of like, be proud loudly. I forget what it is, but the idea is like, let's talk about recovery happens all around us all the time.
Yes, it is so important because, something that I hear, Dr. Rodriguez, is this idea of, well, you can't treat a drug with another drug. So I think it's so important, right?
Thank you for saying that.
Do you want to say something about that?
Yeah, I do. The whole replacement, I think that people often mistake. So there are certain medications that you take for treatment of addictions, particularly opioid use disorder, that you can't abruptly discontinue. You can't just walk away from. You have to do it carefully with the help of a physician or a prescriber. You have to do it in a very intentional, like thoughtful way, because your body does become physically dependent on it. But being physically dependent on it is not the same as being addicted. Keep in mind that addiction is not only loss of control, but it's not being able to do the things or take care of the things or find value in the things that you love, your children, your significant other, your relationships, food, right? I see people come into the emergency room who haven't ate because they've been using for days. And so it's not a replacement, because it's actually the medications are resulting in change in your life and being able to be a part of your life and being able to live your life.
Awesome. Thank you so much for sharing that with us. Guys, this is just so important for all of us to educate ourselves, because a lot of time fear gets in the way, and fear creates judgment. And that doesn't allow for us to create these bridges of really understanding the complexities of people that are suffering or, are dealing with some type of addictive behavior. Dr. Rodriguez, where can people find you?
So you can find me on Psychology Today under Dr. Claudia Rodriguez. Look out for Reclaim Sunshine Psychiatry. We'll have Instagram coming, website coming up very soon. And if you have any questions and are interested in learning more, or if you or someone you know is suffering with an addiction or a mental health disorder, please don't hesitate to reach out. My email is drrodriguez@reclaimsunshine.com.
And I love the name of your practice, because I think you talked earlier about you stop enjoying things that feel good. And we now live in the Sunshine State, and it could be a beautiful day outside, but just how you feel internally doesn't allow you to live a life worth living. Guys, thank you for joining us. If you didn't subscribe to my channel yet, please make sure that you do. Sessions with Paola, and you know that I believe in the power of community. So if you have anyone that would be interested in hearing this information, please share it with them. And up next, we're going to talk about our weekend warriors, our Miamians. We're going to talk about the recreational use of cocaine. So stay tuned. Thank you.